Hello, I'm Mary Delphine. I'm a psychosocial support agent and a mental health advocate. Yeah, I'm here to create awareness on mental health issues to help us to learn more about mental health issues and how we can develop a bouncing back mechanism. We can move on with life. We can be productive in life. We can accept situations in life that happen to us and move on. Yeah, we can develop resilience to bounce back. Thanks for watching the other videos. The last video was on rape, and this is the continuation of that video. We want to look at the signs and symptoms of rape. Always click the notification button to get my subsequent videos. Yeah, thanks for watching and sharing the other videos. So we say rape is a voluntary act that is done on someone without his or her consent. Yeah, rape is a voluntary sexual activity that is done on someone without his or her consent. Yeah, by force, using force, and we talked about there is always an age gap and so on. But now victims of rape will hardly open up to tell us that they were sexually abused. It is us now to pay attention to them, to love them more, to develop maximum amounts of love that can help them to open up to us. We have to be close enough to them, especially children. We have to go down to their level and take them closer to us so that they can open up to us, so we can be able to help them to move on. Yeah, we have some symptoms of children who live in distress or persons living in distress, like people who have been raped, sexually abused, and other persons living in distress. We have some symptoms like sadness, quietness, loneliness, uh, 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 weeping. You see behavioral changes in children. If you are living with children, caregivers or parents, you see behavioral changes in children, like a child that is dissociates from others, don't want to belong to any group, don't want to participate in anything, maybe at school does not want to play, maybe at home does not want to eat, skipping meals and crying, weeping in the night, or maybe shouting in the night, sleeping and getting up and shouting. Know that that child is suffering from one distress or the other. It could be rape. You will never know until you find out. There are also physical symptoms. There are also physical signs that you can see from their movement or from their behavior. Some even cries, headache, stomach bite. Some you even see some they become very aggressive, anger. They become very violent. They don't want to listen to other people, and because they have been raped, they feel that the society no longer wants them, or they feel that they are useless in the society. They feel that they don't have anything to write home about because they feel so inferior. And now that they don't trust us to open up to us. Like some children drop out from school, they run away from home because they have been abused at school or at home by relatives or whoever. So sometimes, because we are not there, parents are absent sometimes, and caregivers, these children run home because they have been raped, crying, nobody to talk to. And sometimes they reach home, they meet us, they look at us, we are not welcoming enough for them to open up to us. So they run away from home, join bad groups, and those groups sometimes they get them into more sexual activities, into more sexual violence, and into more other things like substance abuse. They start getting drugs and so on, just because they had nobody that they can talk to. So sometimes too, we cover perpetrators of violence. We are covering perpetrators of rape, and as we cover them, we do not report them to the right places. These children now, the perpetrators, they continue the acts, so disturbing so many children and so many persons in the society. So there are right quarters for us to report them, and there is also the right quarter for us to take the children who have been sexually abused to, like the women empowerment, to help them to heal. Yeah, to the social welfare and institutions that care for children who have been sexually violated, to help them to heal. Yeah, we have many children, they get into prostitution because of a consequence of rape, because now the persons that they talk to introduce them but to prostitution, and they get into more addiction and more things come in. So let us try to heal them by maybe talking to them calmly, by loving them, and trying to see how we can build resilience in them, helping them to bounce back, to move on, to become useful in the society, and to love themselves so that they can also love others. Yeah, if they cannot love themselves, they will not be able to love others. Thanks for watching the video. You can always keep your comments below. Share and share and share. Thanks so much. I really appreciate it.